these legislative advocates, the power of patient advocacy, where to start, examples of advocacy, and ways to get more involved in the legislative policy and how you can advocate as a rare disease patient. First starting with what the EveryLife Foundation for Rare Diseases is, just as a small primer, because every life matters. The EveryLife Foundation for Rare Diseases is a 501c3 nonpartisan nonprofit organization dedicated to empowering rare disease patient community to advocate for impactful, science-driven legislation and policy that advances the equitable development and access to life-saving diagnoses, treatments, and cures. And per the words of our executive director, we do not speak for patients. We provide training, education, resources, and opportunities to make your voices heard. By activating the patient advocate, we can change policy and save lives. And really, the foundation for the policy goal focus today is empowering patients to take an impactful voice in policymaking, drug development, and the regulatory decision-making process. As the Rare Disease Legislative Advocates Program, we work to educate patient advocates on how legislation and policy impact the availability and access to treatments, providing them resources to advocate on both the national and the state level. We work to build awareness on Capitol Hill and ensure that Congress hears from patients and caregivers, because fundamentally your voice is important to the policies that they enact. And we work to connect every member of Congress with a rare disease advocate. So when they consider legislation, it's not just about treating a disease, it's about saving a person they know. And as we'll work through this presentation, we'll really work on how advocacy and how your voice transform the policy and legislative process into a relationship. Touching on the importance of that relationship between you and your members of Congress and how really policy is all relational. And from this really, and as a foundation, looking back to lessons learned from the AIDS movement, one of the single largest moments where patient advocates and patients helped to fundamentally transform the drug development process through the creation and passage of the Prescription Drug User Fee Act, which continues to help fund drug development to this day. Educated and activated patients are far greater at making change than paid lobbyists. They're the single greatest force for legislative and regulatory change in the United States. And while we're not asking patients today to advocate as patients did in the past, or to protest on the steps of FDA, your voice is just as powerful at making the necessary changes at the federal and state level. Fundamentally, the lessons we draw as a foundation from the movement, and that you can draw as well, is that your voice can help create life-changing changes at the federal level, more so than any paid lobbyist or firm even. But before we really get into that, we really need to discuss, and really the whole point of advocacy training is deciding why you advocate, finding that story, that reason, that cause for you as a patient to advocate on the federal or state level or even city level for your rare disease. Asking yourself, do you advocate for yourself, a loved one, a community? Do you advocate to educate lawmakers and or to solve a problem? Do you advocate because legislation and public policy impact healthcare for you and your loved ones? Maybe to close the gap for the 93% of rare diseases with no FDA-approved treatment, to eliminate the diagnostic odyssey, to improve the regulatory process and advance regulatory science for treatments. Do you advocate for access to safe and efficacious therapies as soon as possible? Finding that reason of why you advocate is one of the most fundamental steps to becoming an advocate. Finding that cause. And as rare disease patients, everyone has that cause. Really, the power of grassroots advocacy, the impact of legislation and policy that can impact the science, the drug development process, and the access to treatments. The federal government and state governments have an immense impact on the development of new therapies and cures. And because of that, the impact of grassroots advocacy has a huge impact on these same processes. By impacting government, you have the power to affect change and to take an active role in the political process and therefore the development process. You have the power as patients, as the grassroots force, to impact legislation and policy at a level that is immense by using your individual story and shared experiences. Advocacy matters, and your legislators want to hear from you. And this isn't just a statement. They want to hear from you. They need your stories to craft legislation, to know what their constituents face. And because your voice matters, they want to hear from you. You're the expert on your rare disease experience, and therefore an expert on the very issues that they're attempting to tackle. And really, just to show this, why relationships matter, here's a chart detailing the impact of constituent visits in person compared to any other means of impacting legislative opinions and operations. As you can see from here, in-person visits from constituents using their voices, using their stories, using their shared rare disease experience has a tremendous impact, the greatest, on the legislative process. You can see from here that in-person visits were rated at 46% of a lot of positive influence, compared to a visit from a paid lobbyist at 8%. Your voice matters more than you could ever know, because your legislators want to hear from you. And there's many ways of advocating, as shown in this chart. It's not simply just visiting your representatives. It can be individualized postal letters. It can be individualized email messages, phone calls, telephone town hall comments, news editorials, individualized faxes. The ways that you have to impact legislation, the regulatory process, and to connect with your representatives on the national and state level are immense and many, and they have a great impact. And we're not really asking anyone to memorize the process by which a bill becomes legislation. Really, this chart should show you all the different areas that you as an advocate can affect. From the introduction of legislation to hearings, subcommittees, and voting. You as a patient advocate have the opportunity as a constituent to impact every single level of legislation in the United States, to have your voice heard, and they want to hear from you. As we've shown, your voice matters and it has impact. Even a simple signed letter sent directly to your member of Congress can have immense impact even on committee assignments. They want to hear from you, and your voice can help make sure that rare disease legislation can pass all the way from introduction to signature. So, we've discussed, why advocacy is important and the different ways that you can advocate and the different specific ways that Congress wants to hear from you. But really ask yourself, what do you do as an advocate? Do you educate? Do you provide guidance? Do you persuade legislators and representatives? Do you pressure? And finding out what you do as an advocate in this process is incredibly important, and understanding what you're comfortable with in being an advocate. We're not asking everyone to immediately jump to being, legislative advocate on the steps of, the United States Capitol. But everyone has a role in advocacy in a different way that they can impact life-saving legislation. And really, how do you advocate? You create relationships with your state and the federal legislators? Do you create a friendship? Do you share your stories with a policy ask? Ask questions. Engage with the SADS Foundation. Support others with their policy goals and when they align. Activate your network. You have one. finding out how you advocate, building on these steps and using them to affect change. Here you can really, cover the do's and don'ts of advocacy. Do, tell your story. Keep it nonpartisan. Stay on topic. Personalize your issue. Say thank you. Build these fundamental relationships. You don't have to cover too many issues. You don't have to argue or forget to follow up. Simply maintain and build that relationship with your members of Congress and your representatives to tell your lived experiences. Always remember to follow up. Always remember to maintain that relationship, to build on it and build a friendship with your congressional office or your senator's office or even your state representatives. And here we've really included an example of a story and what it can be viewed as from our Stat Act campaign.
Adrian, we have no sound.
Oh, yeah.
Can you replay?
Can you? I can replay. Yeah. Can you hear it now? Can you hear it? No.
No.
No. Will this be shared afterward?
We've recorded it, but it's going to record what we're doing now.
Yeah, I can hear the sound on my end. I don't know.
Is it going through headphones or something like that?
Nope, just speakers.
Okay.
And
volume is up, right?
Yep, volume is up. Full volume on my end, 100%.
Okay.
It's a very good elevator pitch. Very good elevator pitch.
Darn it! I wish we could hear it.
Well, you can find it on our Stat Act.
There we go. We can find it on the website. Sure.
Yeah, just search up Stat Act testimonials, EveryLife, and you can find this. But the real, point of what Yash said was delivering an elevator pitch that covered where he was from, the importance of the legislation, the importance of legislation, why it matters for his rare disease, and a call to action. And when telling your story, developing this elevator pitch is incredibly important to making sure that your delivery is quick, that legislators hear the pertinent details, and that has an impact on their decision making. So really, when thinking of, how do I advocate, finding that story at the center of what you do and what you're doing can really help impact this elevator pitch. Sometimes it can be hard to condense down an entire, lived experience into, say, 48 seconds. But really finding out the legislation that you want to impact, the change you want to make, and delivering, this small opening the door bit can really help impact change. Hello, my name is blank. I am from your congressional district. I have a rare disease, and this is how it impacts this legislation. There's 93% of rare diseases do not have a FDA-approved cure. By passing this legislation, it will help, generate access to treatments and cures. And ending of a call to action really helps, with the passage of legislation and impacting change at the federal and state level.
Adrian, we were able to put a link to the YouTube video. It's in the chat for everyone to take a look at later.
Yeah.
Okay.
Okay.
Got it covered.
Okay. Moving on. Thank you. How to get started. Really determining what your goal for advocacy is. Is there a problem that needs to be solved? Insurance coverage for a treatment, needing an FDA approved treatment, needing a diagnosis, funding for research, awareness, and education. Developing that goal and what you want to use your story to affect change on is incredibly important in starting your advocacy journey. Singling out these specific policy changes or necessary legislation, and then using your story to affect that change. So really asking yourself as an advocate or as someone starting on the advocacy journey, what is your goal? And how can I use my rare disease experience or the experience of my community to affect that goal? And really, getting started, deciding what level of government you wish to engage with. And this can range from governors and state legislators to federal representatives and senators, members of committees, leadership, House majority or minority leaders, government agencies, state and local representatives. Deciding what level of government you believe you can impact the greatest level of change on, and you can develop relationships with. And really the fundamental tying cord between all of these different members of government or houses of legislation is that each of them wants to hear from you and has means of public access. You can call your governor, your state legislators, you can call their office at any time. Their job as our members of government is to hear from you. They always have a line open, and they need to hear your voice. So deciding at what level you'd like to engage with your legislators, whether that means calling up your House member for the Congress and saying, "Hi, I'd like to schedule a meeting with my local representative. I'd like to talk to him about my rare disease." To even contacting local government agencies like your Department of Health. You can impact change at any level. And we really, encourage patients not to be daunted by, the sheer complexity of government, but finding where you're comfortable engaging with. Staff are an amazing resource. An in-district meeting are often easier to schedule or more beneficial. It's important to recognize that your Senate, your congressional offices have in-district offices that can be contacted and reached, oftentimes easier than the national offices, but they have just as big of an impact on legislation and representative time. And really, asking yourself when you can engage. And the answer to that is anytime and all the time. It's always time to build relationships with your legislators. It's always time to call and schedule in-district meetings. It's always time to reach out. Pay attention to these bills' progresses through House and Senate news and schedule meetings around key events. Don't wait until it's too late. Be vocal early about the issues that matter to you. If there's legislation that impacts your life or as a rare disease patient, tap into it and find out where you can impact change and build those relationships in order to create that change at the national or state level. Here are some tactics for engagement. No matter how you engage, just make it personal, whether that's phone calls, town halls, op-eds, social media. In-person meetings, holding briefings, letters and emails, media, all of it comes together to fit the puzzle that is engagement. No matter how you engage, just make it personal and make sure that it establishes a relationship between you and whatever member of government you're looking to engage with. Scheduling a meeting is as easy as finding your officials, whether that's through a Google search or through our website. You can type in your zip code, the address, and click on a legislator's name to see their office phone number. Give them a call and let them know that you're a constituent who'd like to schedule a meeting with a staff member. For every office, they will usually have a specific staff member distinctly dedicated to health issues and health policy. These staff members are incredible resources and they want to work and hear from you. Find different ways to connect. Research your decision makers. What issues are they interested in? What legislations have they supported? What do you personally have in common with them? Remembering that our legislators and our representatives are individuals just like us with sometimes shared experiences. You'd be surprised at how many personal meetings with legislators that I've attended that I've heard legislators talk about their own experiences with chronic and rare conditions. It's much more common than individuals would think, yet so are rare diseases. With 30 million estimated Americans in the United States with a rare disease, that equals about to 1 in 10 individuals, which means that you're likely to have a common connection with your members of Congress in rare and chronic conditions. Finding that common ground and connecting with them over it can have a huge impact on how effective your legislative asks are. And remember, rare disease issues are bipartisan. We're not any single party, we're the rare party. Remember using social media as an advocacy tool. Use social media to your advantage. Make them aware of the problems you face through social media. Thank them for the actions they take. Tag the member with photos you took at the meeting. Make sure that you are connected with them through all avenues. As time changes, so does means of advocacy and connecting with your members of Congress. And utilizing the full extent of social media websites like Facebook and Twitter are just as powerful as calling the representative, and are good actions to take, as well as meeting directly with your members of Congress. And remember, be persistent. Thank the member and staffer in the follow-up email or letter and social media, or do all of the above. We deeply encourage. Sign up for the member's newsletters and follow him or her on social media. Look for opportunities to engage with the member in person, such as in district town halls or meetings that they have. Members will often post about meetings and events that they're going to on social media. These are great opportunities to connect with them and talk directly with them. Call their office for relevant action alerts. Thank the member for co-sponsoring or voting on legislation you asked him or her to support. Remember, the center of all of this, of all advocacy and all actions that you take, is relationships. Building these relationships, strengthening them, and asking for support. And remember to stay in touch with their staff. They are often your key avenue for impacting change. You want to be an advocate? We really deeply advise signing up for monthly newsletter, action alerts, and invitations to the monthly webinars and other free events at rareadvocates.org. Utilizing all the resources at your hand, all the resources that are available to impact change for you as an advocate. And I realize in all of this, being an advocate can seem like a really large issue, a very, very deep step that one needs to take. But really, I think the center of all advocacy work that we at the EveryLife Foundation do is making sure that you as patients feel comfortable at any level of advocacy that you wish to take. Using your story and lived experiences to impact policy is deeply important. And finding the level that you are comfortable as an advocate and as a patient in impacting policy is also deeply important. We develop these tools, from webinars to tip sheets to make that process easier and to make that connection with members of Congress as easy as possible. We understand that your time is important and want to make sure that you have the resources and tools to be able to connect with your members of Congress or your state representatives and get the passage of legislation. So in all of this and in all the different ways that you can advocate and becoming an advocate, it's important to understand advocating where you're comfortable and in your community, using community resources and organizations, using resources from the EveryLife Foundation to impact policy and legislation where you are and where it affects you. So, in looking at all of this, finding out, what your story is, attending events, like Rare Disease Week or whatever, or Rare Across America, and impacting legislation at a personal level. Advocacy is different for every person, and the journey and path that we all take to advocacy can be different. But taking it together and as a community is really what we strive for. We really, encourage everyone to stay informed on key policy issues. At our website and at EveryLife, we host monthly webinars that serve as legislative clearinghouses and really talk about the issues that are most important. We have a monthly newsletter that shares the latest policy news, action alerts, and events. We have our state advocacy hub, advocacy tools, tip sheets, policy primers, videos, resources, an online calendar, Facebook and Twitter accounts. We have a lot of different ways, a lot of different ways to engage, and all of them are dedicated to making sure that the advocacy process is as easy and informative as possible for you as patients. We really encourage everyone to, advocate where they are, and as such have developed the State Legislative Action Center and State Advocacy Hub to make sure that whether you're advocating at the federal level or the state level that you're supported, including state advocacy tools and tip sheets, alongside primers that we have as well. As you look at the next steps in your advocacy journey, we recommend looking at various programs. We have a lot of them geared towards one for Rare Across America in-district meetings, and our national flying event, Rare Disease Week, where we have a week-long session, event dedicated to impacting legislation at the national level, directly on the steps of Capitol Hill, as well as a young adult program where we help give young adults the tools that they need to both impact legislation and develop professionally. We also have our Young Adult Leadership Academy and scholarship fund. So really, it's just about finding where you'd like to connect and where you feel comfortable in your advocacy journey. The need is great, and we really have worked and striven to develop the resources for your community. We encourage everyone to attend Rare Disease Week this upcoming year, and Rare Across America, two very important events. As we'll be, developing dates going forward, we really want to meet with, make sure that everyone is getting their voice heard, whether it's nationally or in district. Here's our young adult program. And really to wrap up with a big thank you everyone for taking the time to hear this, to learn about how you can advocate, the different programs and different avenues that we have, and how you can make your voice heard. And now I will turn the mic back to talk about some policy priorities.
Thank you, Adrian. So the SADS Foundation has kind of established some federal issues, national issues that we're monitoring. And so we will work with you as an advocate to provide some background and the fact sheets about the issues, as well as some background talking points. So you're not out there alone, but we'll work with you and we will be communicating with you as an advocate as you set up an individual appointment or a group appointment. So you won't be out there alone. So the SADS Foundation is here to work with you on sharing your story. And you're, as Adrian has pointed out, you are the constituent for your representative. And so they want to hear from you, and your story is unique. And so we're pleased that you want to share it. And I think, at the same time, we're raising awareness of SADS conditions at the same time. So these are some couple bills that are out there right now that we're following, but we also want to try to continue to encourage heart research and telemedicine appointments with our specialists, since they're very few and far between, these electrophysiologists that treat our SADS conditions. So we want to encourage you to stay in touch with us. Go ahead to the next slide, Adrian. These are different ways to stay in touch with EveryLife Foundation as well as the SADS Foundation. And I failed to mention that we are very appreciative of a grant that we received from EveryLife Foundation for this advocacy training and for a media training that we had earlier in the year. that is recorded, and you can actually go back and look at that too to help raise awareness among your media in addition to your legislators. So let's see. You can follow us here on our SADS Foundation page, and there's my contact information if you need more information. One of our questions that was in our Whova app, which we'll transfer here. Also, Jan reminded me that we want to thank the Medtronic organization for a grant also. So one of the questions that came from one of our advocates that's on the training today is, what kind of information should be given for the general public regarding SADS? And I think one of the things that we'll provide for you as an advocate are, as I said, talking points and facts. So I think raising awareness of the warning signs and some stats about sudden deaths and so on that we'll prepare for you and include in the information that we share with you as these bills that we're following and any kind of legislative issue comes up. Has anyone had a telemedicine appointment? Alice asks. You can put it in the chat if you've had a telemedicine with your EP. Amy has not. Looking at the chat here. Rochelle had not with her EP, but another telemedicine appointment. Cool. Colleen's had many. Excellent. Samantha Wilder has attended the Rare Disease Week in the past, and she would encourage that for all. Hopefully, you know, we did this year was on Zoom with your legislative due to COVID, but we'll hopefully next year be in person on the Hill, and maybe some of you can participate in the Rare Disease Week at the end of, maybe the end of February, right? Adrian, is that generally, it's usually like February 28th to March 3rd. It's generally when it is.
Yeah, I think this year we're planning for that week.
Very good.
Yeah.
So if you could, Samantha had great things to say and learned a lot from being there. So I would encourage it for anyone. It looks like Christy's had some telehealth medicine appointments with Johns Hopkins. Wonderful. And we plan to continue this training with you as an advocate before, like in January and February before Rare Disease Week. So stay tuned, keep communicating with us, and we will let you know of some training webinars that will talk about the SADS, federal policies and issues, and the tools that we can provide for you. So we encourage you to stay in touch.
Yeah, and please, you feel free to reach out to EveryLife and myself. We really always are looking to help advocates, you know, advocate on the national and state level. You know, tools, trainings, really just connecting with your legislators and providing any help that we can. Yeah.
Wonderful. So are there any other questions in the chat that you want to post, folks, on Zoom that we can address? We have about 20 minutes before our next presenter, Dr. Barul, who will be talking about the future of ICDs for everyone. So he won't come on for another 20 minutes. So let's see, other questions? I'm looking in the chat here.
There is, I believe, a national rare disease organization in Canada. Yes.
Okay, kind of your counterpart, right?
Yeah. Their name is escaping me right now, but there is a national rare disease organization in Canada.
Excellent. We could do some research and get back to you, Jill.
The beginning was largely just an overview of the foundation. We're a 501c3 nonprofit, nonpartisan organization that is dedicated to helping patients advocate. Yeah, if there's anything specific you'd like me to recap or cover, definitely happy to. But yeah, the first part of the presentation was largely a cover of our organization, which was also covered throughout.
And this session was recorded, so you can actually go back, Colleen, and check it out. So no worries there. Okay. All right. I want to thank Adrian for all of his expertise and sharing about how to advocate